Introduction. Coronavirus infection 2019, COVID-19, is characterized as a disease brought about by a novel coronavirus now called Serious Intense Respiratory Disorder Coronavirus 2, which was first identified amid an episode of respiratory sickness cases in Wuhan City, Hubei Province, China. It was at first answered to the WHO on December 31, 2019. On January 30, 2020, the WHO pronounced the COVID-19 episode a worldwide health crisis. On March 11, 2020, the WHO announced COVID-19 a worldwide pandemic, its first such assignment since proclaiming H1N1 flu a pandemic in 2009. Ailment brought about by SARS-CoV-2 was named COVID-19 by the WHO, the abbreviation got from Coronavirus Malady 2019. The name was picked to abstain from criticizing the virus inceptions regarding populaces, topography, or creature affiliations. 6. On February 11, 2020, the Coronavirus Study Group of the International Committee on Taxonomy of Viruses gave an announcement declaring an official assignment for the novel virus, Extreme Intense Respiratory Condition Coronavirus 2, SARS-CoV-2. The Centers for Disease Control and Prevention, CDC, has assessed that SARS-CoV-2 entered the United States in late January or early February, building up low-level network spread before being taken note. Since that time, the United States has encountered broad contaminations, with more than 206,000 passings detailed as of October 1, 2020. On April 3, 2020, the CDC suggested that the overall population, even those without manifestations, should start wearing face covers in open settings where social removing measures are difficult to keep up to lessen the spread of COVID-19. The CDC had proposed that this circumstance could bring about huge quantities of patients requiring medical consideration simultaneously, bringing about overburdened general health and healthcare frameworks and, conceivably, raised paces of hospitalizations and passings. The CDC prompted that non-pharmaceutical intercessions, NPIs, will fill in as the most significant reaction technique to postpone viral spread and lessen malady sway. The practicality and ramifications of systems for concealment and moderation have been thoroughly breaking down. They are being energized or upheld by numerous legislatures to slow or end viral transmission. Populace-wide social separating of the whole populace in addition to different mediations, e.g., home self-disengagement, school and business terminations, was firmly prompted. These arrangements might be required for extensive stretches to maintain a strategic distance from the bounce-back viral transmission. As per the CDC, people at high danger of disease remember people for territories with continuous neighborhood transmission, healthcare laborers thinking about patients with COVID-19, close contacts of tainted people, and explorers getting back from nearby spread areas accounted for. Individual-to-individual spread of SARS-CoV-2 has been accounted for in the United States. People who accept they may have been presented to SARS-CoV-2 should contact their healthcare supplier. The CDC has also given proposals to people at high danger of COVID-19 related difficulties, including more established grown-ups and people who have genuine basic health conditions, e.g., coronary illness, diabetes, lung disorder. Such people ought to think about the accompanying safeguards. Stock up on provisions. Evade close contact with debilitated individuals. Wash hands often. Remain at home however much as could be expected in areas where COVID-19 is spreading. Build up an arrangement if there should be an occurrence of ailment. What you should know about COVID-19. As COVID-19, coronavirus, keeps on spreading, comprehension of the virus that causes this infection keeps developing. It was first distinguished in China and immediately spread worldwide to each mainland other than Antarctica, setting off a pandemic assignment by the World Health Organization. The virus itself is called SARS-CoV-2, and the infection it causes has been named COVID-19. What we know and what we don't. Since this virus is new to researchers, there is still a lot to be perceived about the total clinical picture. COVID-19 has a scope of clinical manifestations, from mellow to life-compromising. In any case, many have recuperated despite no affirmed treatment, says infectious disease specialist Gary A. Noskin, MD, Senior VP and boss medical official at Northwestern Memorial Hospital. The illness is accepted to have initially happened from creature-to-individual contact and spreads individual to individual. Individuals are presently building up this disease in the network with no known introduction. Researchers are attempting to more readily see how best to treat, just as forestall, this disease, says Dr. Noskin. Moreover, the research looks to all the more likely to comprehend the microbe science to build up an antibody and helpful drugs. Researchers are attempting to all the more likely see how best to treat, just as forestall, this disease. While we are as yet getting familiar with the advancement of COVID-19 and its clinical profile, there are steps you can take to secure yourself as well as other people, says Dr. Noskin. To be specific, it's essential to remain educated and take similar regular preventive measures as you would to dodge any kind of contamination. 1. Side effects can seem to be like this season's virus. Side effects incorporate fever, hack, sore throat and windedness, and may seem 2 to 14 days after presenting the virus. What's more, since flu is likewise a viral respiratory disease, they can look fundamentally the same. A determination, taken by swab, is the best way to genuinely affirm the disease's reason. In any case, information proposes flu and COVID-19 spread differently. COVID-19 appears to communicate effectively, which is why significant endeavors at the underlying beginning of cases were devoted to separating those presented to the virus. In contrast to flu, no antibodies are accessible for COVID-19. Researchers are taking a shot at improving antibodies and treatment choices, and some are now being tried. 2. It's communicated through beads, and thought to be most infectious when an individual is indicative. COVID-19 spreads predominantly between individuals who are in close contact with each other, roughly 6 feet. The virus can be communicated in beads that become airborne through a hack or wheeze from somebody demonstrating indications of COVID-19. Be that as it may, the window before manifestations happen, known as a brooding period, keeps going a normal 5 days. Specialists don't have the foggiest idea of how the virus is communicated during the hatching time frame. However, they trust it as well on the way to spread when an individual is indicating manifestations. Specialists also don't have the foggiest idea of how long the virus can live on surfaces, so it's essential to make preventive strides like utilizing appropriate hand cleanliness and abstaining from contacting your face, mouth, and eyes. 3. Certain people might be at more danger for genuine ailment. The ailment has commonly been gentle for kids and youthful grown-ups. Be that as it may, certain populaces are more in danger for genuine ailment. The weakest populaces incorporate old individuals and people with basic conditions, for example, coronary illness, lung infection, and diabetes. These populaces should take extra preventive estimates when conceivable, for example, staying away from superfluous travel and swarmed spaces. 4. Secure yourself and your family. Notwithstanding remaining educated, Dr. Noskin urges everybody to practice insurance to help shield yourself as well as other people from the spread of contamination. Wash your hands. Cleanser and water are the most ideal choice. If cleanser and water are not accessible, use hand sanitizer with in any event 60% alcohol. Abstain from contacting your mouth, face or eyes. Wearing glasses or gloves may help remind you. Spread any hacks or sniffles, discarding utilized tissues right away. Also, abstain from sharing individual things like glasses, eating utensils, towels or bedding. Regularly spotless surfaces. Clean and sanitize high traffic zones, including door handles and sinks. Remain at home if you're wiped out. 5. Recognize what to do if you're wiped out. If you are feeling debilitated, screen your side effects cautiously. Contact your doctor for direction if you have side effects of COVID-19, incorporating a fever, hack or windedness. Kindly recall. Try not to go to your doctor's office first, as you could chance tainting others. Rather, call ahead to your doctor to talk about proper following stages. Remain at home except if you are looking for medical consideration. Attempt to limit your development to one territory of the house, away from others, including creatures. Clean and sterilize surfaces. If you are displaying side effects and choose to look for help, wear a face veil if accessible to abstain from contaminating others. Causes and symptoms of COVID-19. Specialists are learning new things about this virus consistently. Up until this point, we realize that COVID-19 may not at first reason any manifestations for certain individuals. You may convey the virus for 2 days or up to 2 weeks trusted source before you notice side effects. Some basic side effects that have been specifically connected to COVID-19 include windedness, a hack that gets more extreme after some time, A second-rate fever that steadily increments in temperature. Exhaustion. More uncommon indications include chills, continued shaking with chills, sore throat, cerebral pain, muscle throbbing painfulness, loss of taste, loss of smell. These indications may turn out to be more serious in certain individuals. Call crisis medical administrations if you or somebody you care for have any of the accompanying indications. Inconvenience relaxing. Blue lips or face. Determined agony or weight in the chest. Disarray. Over-the-top tiredness. The Centers for Disease Control and Prevention, CDC trusted source is as yet examining the full rundown of side effects. COVID-19 versus this season's virus. We're finding out about whether the 2019 coronavirus is pretty much lethal than the occasional influenza. This is difficult to decide because the quantity of absolute cases, remembering gentle cases for individuals who don't look for treatment or get tried, is obscure. In any case, early proof recommends that this coronavirus causes a greater number of passings than the occasional influenza. An expected 0.04 to 0.2% trusted source of individuals who built up influenza during the 2019 to 2020 influenza season in the United States kicked the bucket as of April 4, 2020. This is contrasted with around 6% of those with an affirmed instance of COVID-19 in the United States, as indicated by the CDC trusted source. Here are some regular indications of influenza. Hack. Runny or stodgy nose. Sniffling. Sore throat. Fever. Cerebral pain. Exhaustion. Chills. Body hurts. What causes coronaviruses? Coronaviruses are zoonotic. This implies they first create in quite a while before being communicated to people. For the virus to be communicated from creatures to people, an individual needs to contact a creature that conveys the contamination. When the virus creates in individuals, coronaviruses can be communicated from individual to individual through respiratory beads. This is a specialized name for the wet stuff that travels through the air when you hack, sniffle, or talk. The viral material hangs out in these beads and can be inhaled into the respiratory plot, your windpipe and lungs, where the virus would then be able to prompt a contamination. It's conceivable that you could procure SARS-CoV-2 if you contact your mouth, nose, or eyes after contacting a surface or item that has the virus on it. In any case, this isn't believed to be the principal way that the virus spreads. The 2019 coronavirus hasn't been conclusively connected to a specific creature. Scientists accept that the virus may have been passed from bats to another creature, either snakes or pangolins, and afterward sent to people. This transmission probably happened in the open food market in Wuhan, China. How to stop COVID-19 with yourself. Skill it spreads. There is presently no antibody to forestall coronavirus ailment 2019, COVID-19. The most ideal approach to forestall sickness is to abstain from being presented to this virus. The virus is thought to spread principally from individual to individual. Between individuals who are in close contact with each other, inside around 6 feet. Through respiratory beads delivered when a tainted individual hacks, wheezes or talks. These beads can land in the mouths or noses of close by or perhaps be breathed into the lungs. Some ongoing investigations have recommended that COVID-19 might be spread by individuals who are not demonstrating indications. Everybody should. Hands wash light symbol. Wash your hands often. Wash your hands often with cleanser and water for in any event 20 seconds, particularly after you have been in a public spot, or after cleaning out your nose, hacking, or sniffling. It's particularly essential to wash before eating or planning food, before contacting your face, after utilizing the bathroom, after leaving a public spot, in the wake of cleaning out your nose, hacking, or wheezing, in the wake of dealing with your veil, in the wake of changing a diaper, after thinking about somebody debilitated, after contacting creatures or pets. If cleanser and water are not promptly accessible, utilize a hand sanitizer that contains at any rate 60% alcohol. Spread all surfaces of your hands and rub them together until they feel dry. Abstain from contacting your eyes, nose, and mouth with unwashed hands. Individuals bolts light symbol. Evade close contact. Inside your home, Avoid close contact with individuals who are debilitated. If conceivable, keep up 6 feet between the individual who is debilitated and other family individuals. Outside your home, put 6 feet of separation among yourself and individuals who don't live in your family unit. Recall that a few people without side effects might have the option to spread virus. Remain in any event 6 feet, around 2 safe distances, from others. Keeping good ways from others is particularly significant for individuals who are at higher danger of becoming exceptionally ill. Spread your mouth and nose with a veil when around others. You could spread COVID-19 to others regardless of whether you don't feel debilitated. The veil is intended to ensure others if you are tainted. Everybody should wear a cover in open settings and when around individuals who don't live in your family unit, particularly when other social removing measures are difficult to keep up. Covers ought not be put on small kids under age 2, any individual who experiences difficulty breathing, or is oblivious, debilitated or in any case incapable to eliminate the veil without help. Try not to utilize a cover implied for a healthcare laborer. Presently, careful veils and N95 respirators are basic supplies that ought to be held for healthcare laborers and other people on call. Keep on keeping around 6 feet among yourself as well as other people. The veil is not a substitute for social removing. Spread hacks and wheezes. Continuously spread your mouth and nose with a tissue when you hack or wheeze or utilize within your elbow and don't spit. Toss utilized tissues in the garbage. Quickly wash your hands with cleanser and water for in any event 20 seconds. If cleanser and water are not promptly accessible, clean your hands with a hand sanitizer that contains in any event 60% alcohol. Spray bottle symbol. Clean and sterilize. Clean and sanitize often contacted surfaces every day. This incorporates tables, door handles, light switches, ledges, handles, work areas, telephones, consoles, latrines, fixtures, and sinks. If surfaces are messy, clean them. Utilize cleanser or cleanser and water preceding purification. Then, utilize a family disinfectant. Most regular EPA enlisted family disinfectants external symbol will work. Screen your health daily. Be ready for indications. Watch for fever, hack, windedness, or different manifestations of COVID-19. Particularly significant if you are getting basic things done, going into the workplace or work environment, and in settings where it might be difficult to keep a physical separation of 6 feet. Take your temperature if indications create. Try not to take your temperature inside 30 minutes of practicing or after taking prescriptions that could bring down your temperature, similar to acetaminophen. Follow CDC direction if manifestations create. Ensure your health this flu season. Seasonal viruses and the virus that causes COVID-19 will both spread this fall and winter. Healthcare frameworks could be overpowered treating the two patients with influenza and patients with COVID-19. This implies getting an influenza antibody during 2020 to 2021 is a higher priority than any time in recent memory. While getting an influenza antibody won't secure against COVID-19, there are numerous significant advantages. For example, influenza immunizations have been appeared to lessen the danger of influenza sickness, hospitalization, and passing. Getting an influenza immunization can likewise spare healthcare assets for the consideration of patients with COVID-19. Just like the case in any flare-up, the CDC is adopting the strategy that it's smarter to be over-arranged than under-arranged. It appears to occur with the episode of any new virus or illness, however deception encompassing COVID-19 is wild, particularly via web-based media. The World Health Organization, WHO, has put out a progression of illustrations via online media exposing regular COVID-19 fantasies. You shouldn't splash your body with chlorine, and garlic doesn't have unique COVID-19 avoidance properties. It's justifiable for individuals to be worried about COVID-19, and it's never a poorly conceived notion for the regular individual to find a way to forestall the spread of a disease. Nonetheless, the means to shield yourself from COVID-19 should be extremist ones. Rather, have a go at making these 5 little changes following guarantee that you're following the accepted procedures for general disease counteraction and control. These alterations aren't simply centered around COVID-19, however are reasonable health tips that will help forestall the spread of numerous basic ailments, including this season's virus and the regular virus. 1. Practice great hand cleanliness. It sounds straightforward, however it's actual, Acceptable hand cleanliness keeps the transmission of a virus starting with one individual then on to the next. Time and again, individuals possibly wash their hands when they're dirty. Nonetheless, viruses and microorganisms are tiny, which means they can be available regardless of whether your skin looks clean. Washing your hands habitually is an incredible method to keep away from an assortment of diseases, not simply coronavirus. To keep your hands clean, wash them altogether utilizing cleanser and water for in any event 20 seconds. Hand washing recurrence will differ from individual to individual, however it's consistently a smart thought to wash your hands before eating, after utilizing the restroom, and in the wake of wheezing or hacking. You can watch a video showing of legitimate hand washing strategies underneath. If cleanser and water aren't accessible, an alcohol-based sanitizer can be utilized. The CDC suggests utilizing a sanitizer that is at any rate 60% alcohol. 2. Abstain from hacking or wheezing into your hand. Covering a hack or wheeze may appear to be something that ought to be done just out of good habits, yet it goes a piece past that. You ought to abstain from hacking or sniffling into your hand whenever conceivable. When you hack or wheeze into your hand, you have the capability of moving microbes or viruses onto that hand. Those microscopic organisms and viruses would then be able to be spread to different surfaces you contact. Rather, attempt to hack or sniffle into a tissue. If a tissue isn't accessible, attempt to cover your hack or sniffle utilizing your elbow/upper arm. While these strategies may not be great, they can help forestall the spread of microorganisms and viruses. In the wake of hacking or sniffling into a tissue, discard the tissue. Make certain to wash your hands after a hack or wheeze also. 3. Remain at home if you are wiped out. While it's honorable to be devoted to your activity or your examinations, it is anything but a smart thought to go into work or school if you're debilitated. You may figure you can control as the day progressed, however you risk tainting everyone around you. If you're not feeling great, remain at home and let yourself recoup. If you need to go out openly, attempt to wear a face cover to abstain from tainting others. If you're a parent and your youngster isn't feeling great, it's ideal to keep the person in question home from school. Sicknesses can spread quickly in school settings, and you don't need your kid to get their schoolmates debilitated. Everybody's had that natural sentiment of gracious, I presumably might have gone in today. But when you're debilitated, it's smarter to be protected than sorry. Your chief or your educator will thank you for keeping those germs at home. 4. Think about options in contrast to shaking hands. Broadening a handshake is a typical welcome or indication of regard, in the case of settling a business negotiation or meeting somebody unexpectedly. Nonetheless, as examined over, your hands can convey microorganisms and viruses. This implies shaking somebody's hand accompanies the danger of giving microorganisms or viruses to that individual, or the other way around. Since it's a respiratory affliction, COVID-19 is spread by beads ousted from the respiratory framework by a sniffle or hack. Be that as it may, if a tainted individual hacks or wheezes into their hand, there's a chance of transmission through hand-to-hand contact also. Ideally, where everybody watched good hand cleanliness guidelines, shaking hands wouldn't be a very remarkable concern. In any case, we realize that numerous individuals aren't tenacious about observing their hand cleanliness. In light of a legitimate concern for being cautious, it is anything but an impractical notion to scale back handshakes and consider a few choices for now. This is an applicable change during standard cold and influenza season as well, not simply with COVID-19. Something like an Air 5, a snappy wave, or a gesture can be a decent substitute for a handshake. If you're apprehensive you may appear to be discourteous by declining a handshake, there's no mischief in clarifying why. If you do wind up in a circumstance where you're greeting various individuals warmly, it's consistently a smart thought to subsequently wash your hands. 5. Attempt to abstain from contacting your face. Contacting others' hands isn't the main hand-related practice to decrease. You should attempt to abstain from contacting your face with your own hands as well. As referenced over, it's workable for beads to be moved through hand-to-hand contact. Thus, it's a smart thought to abstain from contacting your eyes, nose, and mouth. If beads containing the virus advanced onto your hands, contacting your eyes, nose, or mouth would be the essential method to move those beads into your own body. Great hand cleanliness will decrease the odds of those beads existing on your hands in any case. Yet attempting to restrict how often you contact your face is another acceptable advance to take. Making these little changes will go far toward helping you keep away from various regular ailments, not simply coronavirus. Suppose you have side effects that coordinate those of COVID-19, fever, hack, windedness, and an applicable travel history or close contact with a patient with an affirmed case. In that case, you should contact your consideration supplier. How to stop COVID-19 with your family. The COVID-19 pandemic necessitates that we stay cautious in our regular day-to-day existences. We can each find a way to help moderate the spread of coronavirus infection and ensure ourselves, our families, and our networks. The means are: wash your hands often with plain cleanser and water. Spread your mouth and nose with a fabric face covering or non-careful veil when around others. Evade groups and practice social removing. Remain at any rate 6 feet separated from others. Here are a few different ways you and your family can help moderate the spread of coronavirus illness.